Drinking and Driving Laws, Driving While Under the Influence of Alcohol, Part 2. The level of alcohol in the blood, BAC. We'll talk about blood alcohol content, BAC, what it implies, and how it relates to how much you've consumed, to kick off our DUI program. The majority of drivers are able to recall that the legal BAC limit is 0.08% at a moment's notice. However, you're likely to get a range of radically inaccurate answers if you ask them what it translates to in terms of the number of drinks or ounces of alcohol ingested. If you have drunk any alcohol, a number of things will contribute to your blood alcohol content. These consist of 1. What brand of alcohol you consumed. 2. How soon you consumed it. Whether you have anything in your system that could slow down how quickly you absorb alcohol, carbonated drinks, food, other drugs. Your genetic makeup, age, gender, weight, and ability to consume alcohol. It's not an exact science to determine whether you can legally drive after drinking. It is understandable why so many drivers make mistakes. A preliminary estimate of your BAC can be formed, nevertheless, using formulas based on when you drank, how much you drank, how much you weighed, and your gender. You may find the formula for this in our complete BAC video along with an easy-to-understand explanation. Your BAC does not necessarily indicate how intoxicated you are, just as the quantity of drinks you have does not precisely correlate with your final BAC. Diverse blood alcohol levels cause different reactions in people. At 0.02%, one individual may be completely incapacitated, whereas at 0.06%, another person may be alert and capable. Due to this issue, police officers have the authority to pull over drivers for suspicion of DUI even when their blood alcohol content, BAC, is less than 0.08%. You might anticipate spending the night in a jail cell if you have any alcohol in your system and are acting intoxicated. Alcohol consumption and abstinence. You will discover what happens to your body when you take alcohol in part 2 of this video. This will consist of 1. The process by which alcohol enters the blood. 2. How the body gets rid of alcohol. As soon as alcohol enters the bloodstream through the brain, it starts to have the symptoms of alcohol intoxication. As some alcohol is taken straight into the blood via the mouth and upper digestive tract, this occurs sooner than you might believe. The average rate at which people flush alcohol from their systems is 0.015% per hour, though this varies slightly depending on metabolic rate. Accordingly, it will typically take an individual with a BAC of 0.08% 5.3 hours to become entirely sober after stopping drinking. Drinking alcohol and sensory impairment. Alcohol passes through your brain and circulates throughout your body via your circulatory system. Every conscious and unconscious action you do is managed by the intricate system of chemical and electrical signals that the human brain uses to function. Alcohol disrupts the delicate chemical balance in the brain since it is a substance in and of itself. This results in altered moods, a decline in cognitive function, the capacity to reason clearly and make decisions, vision problems, and poor motor skills. These effects will be more severe the more alcohol your brain processes. Drinking alcohol non-stop will eventually kill you by interfering with your brain's ability to control your breathing and heartbeat. One of the first effects of intoxication to manifest is sensory impairment. Even a small amount of alcohol consumption can cause a fatal car accident since impaired mental and physical abilities enhance the likelihood of a fatal mistake. If your perception is compromised. 1. When you scan the road from a distance, objects could appear blurry. 2. You can miss close imminent dangers on the road. 3. You can overestimate the amount of room around your car. 4. You might not see other drivers coming from the side. 5. You might read pavement markings, signals, and road signs incorrectly. It's crucial to realize that any sensory impairment raises danger. You might not be aware that you are intoxicated, but as soon as you take your first drink, your chances of missing important roadside information and being in a fatal collision increase. Physical impairment and alcohol use. No area of your body is secure once alcohol has entered your system. It's critical to keep in mind that alcohol is poison. Your entire body will be compromised to some degree, albeit some organs, tissues, and bodily processes will be more severely impacted than others. Alcohol impairs your body's capacity to manage and coordinate itself, as well as your heart rate, blood pressure, respiration, digestion, and kidney function.